Every caregiver has a story. This is Voices of Care, where real voices remind us we're never alone in this journey.
Hi everyone, and welcome back to Voices of Care, where we share the real stories behind caregiving. Not the highlight reels, not just the polished moments, but the honest human side of what it means to look after someone you love. Today, we are joined by someone who lives in two worlds and balances both with heart. He's a chiropractor who helps people heal their bodies, and he's also a caregiver who understands the emotional and physical weight of caring for another. Please welcome Dr. Kelvin Ng. Kelvin brings a rare dual perspective, clinical expertise, and lived experience. And that's exactly why today's conversation matters, because caregivers so often forget one thing, their own bodies. So let's dive into his journey, what he learned, and how you, as a caregiver, can care safely, strongly, and sustainably. Kelvin, let's start with your story. How did you first step into caregiving?
Okay, yeah, thanks for having me, Ivan. My story is quite interesting. I didn't realize I was doing caregiving until probably 10 over years ago. But when you think about caregiving, you're always not thinking about human beings, right?
That's right.
But my journey started with my dog.
Oh, okay.
So my dog then, probably about 10 years ago, she was diagnosed with a heart problem. And then it's quite a difficult disease to have because with an enlarged heart, she will always have to be under medication. And then the medication will help to give some relief to her heart, but at the same time, she will be always very thirsty. And then she will have to take some medication to drain the fluids in her lungs.
Right.
So on the one hand, she's helping with her heart, but on the other hand, she's thirsty all the time. Oh. And she's always drinking.
Okay.
So she will always want to go to the toilet, right? I didn't really understand much about it until one day when the doctor told us about it. I started realizing that, wow, I'm almost on duty around the clock. Because when I get home, she'll be thirsty, she'll be having her dinner, then she'll be drinking a lot of water, and then she'll go to the toilet. So
right.
On the night, probably you have 1 a.m., 3 a.m., 5 a.m., I'll have to bring her to the toilet. Yeah.
That's like a 24-hour care.
It's almost like 24 hours. It dawned on me that, now looking back, I realized that, my caregiving journey started then already.
Okay.
Yeah, but of course, then she passed on early last year. And then just then, my mother-in-law, she had a fall. She first fractured her hip, then she fractured her shoulder.
In the same fall or a separate fall?
Separate fall. So there was two separate falls altogether. Okay. And then after that, then my father-in-law was diagnosed with cancer. Oh. And then we had to scramble for a helper, Mm-hmm. Of course, both of them passed away last year as well. And then this year, my dad was diagnosed with dementia. So my journey started with my dog. And then now I'm just carrying on this journey.
So it's and how many years has it been in total already?
Probably about 10 over years since
already.
My dog. But for my in-laws to my parents, probably about 4 to 5 years.
Right. This decade-long journey is definitely not easy. What surprised you most about caregiving from a physical or emotional level? What struck you in a way that you never imagined it to be?
I think it's both emotional and physical. Emotional, I feel that in a way, once you step into caregiving, it's like a turn-on switch. And it never stops.
There's no off switch, right? It's only on and that's it.
Because it plays in your mind that you're on duty. Mm-hmm. And then like for me, I will always have my phone on my side in case something happens.
No sleep mode.
No sleep mode, yeah. And then you can't be placing it too far away. I had my experience because back then when my mother-in-law had some trouble, I had my phone in my living room, charging my phone, right? And then I was sleeping at night, and somehow, coincidentally, I woke up quite early that day, about 5 a.m., and my phone rang. Because that was when the helper called and said my mother-in-law was in some trouble. And that was when we were able to activate the ambulance.
Right. So thankfully you woke up to be able to respond to it.
Yeah.
Otherwise, you'll be time delayed again, right?
Yeah. And then of course the physical part would be caregiving they tend to put themselves into the chores of maybe helping, transferring, and then sometimes even sitting, and they don't have the luxury of sitting in the most ergonomic chairs or sleeping on the nicest bed, because when you're on duty, they're on duty.
And you just make do with whatever you have, I presume, right?
Yeah, and that would be a physical part. So there are two components of it.
Okay. Now, how has caring for a loved one shifted the way you practice as a chiropractor?
I guess the most significant part would be to have the empathy.
So chiropractors, not empathy last time.
No,
not
I
empathetic.
mean, for me, in my own experience, maybe not as sensitive. You know, when I do take care of patients who are on wheelchairs and patients who have loved ones where they're providing caregiving to, there wasn't this conversation that we had. But of course, now that I'm into it, I can relate to them, and the language you speak is a bit different. You know, that we know that they have the prior experience, and we can talk about some common terms.
That's relatable,
And,
right?
And also, in my clinic perspective, sometimes when patients come in a wheelchair, and then I will be extra sensitive to them, and like simple things like helping them to open the door, and maybe telling the patients who are already there that maybe can you let them go first, you know, because they can't be waiting for too long, right?
Yeah. You know, it's interesting, this point about empathy that you brought up, right, is that it just happened to me last week. So my eyes are swollen. I went for a procedure and I made a bad mistake by having heat compress, because that apparently resulted in one of the capillaries or blood vessels bursting, resulting in a swell. And what happened was it deteriorated really, so it was actually improving ever since the procedure, but it started deteriorating rapidly on Friday night, where I couldn't really sleep well. And then Saturday night, it was terrible. And then come Sunday, my whole left eye, not just the lids, even the eyeball itself, the cornea itself, was blistering. And it's red all over with little wavy blisters on top, right? And at that point in time, I was so worried because it felt like this procedure would have resulted in me losing my vision. And that frightened me a lot out of me. I tried reaching out to the clinic, no names here, but there was an emergency number to call. I called, and apparently they didn't pick up. And at a point in time, right, really as patients, what we seek is really, and I would say, maybe I would say a reassurance that you're okay. It's part of the recovery process. Things didn't go as planned, but it's part of the recovery process. Don't worry, you won't lose your eye. We want that kind of affirmation or reaffirmation that things are okay. We want the empathy from the doctors. And can you imagine when you, as a doctor, taking care of a patient's needs first from a very different angle, he would respond very differently. So for my case, fortunately, the doctor was a friend's friend. So I could, through my friend, reach the doctor after office hours directly. And he responded also very professionally that, hey, don't worry, I've seen your eye. It looks like it seems to have worsened, but it's progressive in a way whereby it's part of the recovery process. So it goes like, it tips off, then comes off and solves itself, right? So don't worry about it. And then, of course, I felt better. So I can almost understand that the empathy portion, if you have it with the patients, I think the way they respond back is also very different, right? Because I know that's why it's risk in everything we do. In any procedure we do today, whether it's chiropractic or anything else. But if it's not a blame shifting, which sometimes we do see, and you didn't follow my instructions, then it becomes my fault. That's not what we want to see as patients as well. So I think the empathy portion it's a really great example. What about, was there a turning point in your journey that changed how you see aging or family through this journey?
There is. I guess the moment that struck me into caregiving was the moment where I put my hands on a wheelchair. Yeah, because to be frank, even as a healthcare provider, I never had a chance to handle a wheelchair. Apart from maybe a patient in a wheelchair coming in to see me, I might just have the caregiver to position them nicely so I can treat them. But when you are really on your hands are on the wheelchair and then folding them and putting in your car, that will suddenly strike you like, wow, I'm doing caregiving now. Yeah. So that was the moment that changed my perspective of how tough it can be when you're doing caregiving.
It's become, in a way, an unfortunate asset of your day-to-day life already, right?
And also maybe on the same note, I'm also a bit more sensitive to people moving around in a wheelchair.
That's true.
Because I remember one incident where my mother-in-law just passed, and then on the same day that I came face to face with this lady in wheelchair, then her helper was also as old as her. They were trying to navigate up a slope.
Okay.
And that kind of like, it's an automatic thing.
You went and helped that.
I went to help, but it was a tough slope.
Okay.
And that was it was an automatic thing.
Right.
To have the sensitivity
to
look around for people who need help.
I think you have walked the path, you know how difficult it can be sometimes, and especially for two women not exactly young,
Yeah.
struggling, you want to step in to help because you have been through that journey yourself. I think that's great. Your lived experience gives so much depth to the conversation. Maybe now let's tap into your professional life as a chiropractor.
Okay.
All right. Let's go into the first question. Maybe from what you see in a clinic, what are the most common injuries that caregivers struggle with?
I would say back pain.
Okay.
Yeah. That would be quite a easily sustained injury because, I mean, wheelchair is one good example.
Okay.
Yeah. And then sometimes the transfer movement.
Right.
Well, this back pain can both be on a caregiver as well as the patient receiving or the loved one receiving the caregiving. Because when you leave, you don't have the proper technique, you may actually be hurting your back. Or sometimes you have a weak core muscles. Yeah.
Okay.
You can be having that. Or sometimes even when they are attending to their family members, they're sitting there for a long period of time.
Just waiting in this.
Yeah.
Okay.
Or maybe just having a chair that's not ergonomic, not supportive enough.
Is this chair ergonomic for you?
This is okay.
It's okay.
It's quite comfortable.
This is good. This is from IKEA, so it's good value for money. And now that you mentioned that they are sometimes caught in wrong positions or awkward positions, what posture mistakes do caregivers make when helping someone stand, sit, or get out of bed? Could we demo? I don't know. Is this space enough for you to demo or to show us at least how it should be done properly?
Yeah, we can do a very quick one. So
Can we see? Let us know where the limit is. Okay, yeah.
okay. So normally what I notice is that for a lot of caregivers, when they help someone up, they tend to bend their back and lift them up.
Yeah, that's a natural like, okay, we bend to
so they
bring
bend
them up.
and then lift them up.
Okay.
And then of course the technique is important. You want to be keeping your upper body straight, and then you try and use your legs.
So the same way you just like what they do, bend your knees down, lift it up.
Yeah,
But,
that's right.
But then there's this distance, right? So how do you compensate for that?
Well, it is a
Still do.
multifaceted issue because you need to have a strong core in the first place. But
Okay.
if you don't have that strength, then you probably will benefit from having a back brace.
Right. So you put like a back brace to put on to support the
Yeah.
lifting.
So having the right technique helps.
Okay.
Yeah, and of course not to take shortcuts.
A
So
lot of
some
us
people tend to do that.
a lot of people
And then
tend
you
to
want
do
to
that.
have a systematic approach and using walking frames,
Okay.
assistive devices around will be very helpful.
Are there like cheat sheets? I don't know. Towels, do you loop around and all that stuff?
There might be, but it's not quite
Not recommended.
practical in Singapore context. Depending also on the situation of
And
the loved one.
whatever, sitting down?
Yeah.
Same thing?
One I've noticed is that for
People just-
we made the loved one, right?
Yes.
Yeah. It's always good to go slow and place them slowly and
Okay.
not just drop them.
Which happens with, I think, a lot of external help.
I do see that for some helpers as well. When they transfer and then they just drop and then the loved one will end up.
Oh,
Yeah,
on the chair.
having an impact on the back.
That's not great. That's not great.
Yeah.
Well, thanks for the examples. These
problem.
are very, I think, good reminders that we need to be very careful of our posture and how we maneuver. The patients and the caregivers themselves, right? What are the early warning signs that caregivers' bodies is saying, no, this is not right. Stop doing what you're doing. It's wrong. So how does your body tell you that's the limit?
Yeah. So usually when they come back, when they experience some back pains, and then
Okay.
it keeps on coming back.
Right.
It's not like a one episode where it goes away after maybe 2 or 3 days or a couple
Okay.
of hours. But if it comes back again and again, and especially when you do some chores like maybe the transfer portion, and they feel the pain, and if the pain gets worse, more frequent, or maybe even some numbness to the legs,
That's bad.
that's a red flag.
No, that's a big, huge red
they
flag.
shouldn't-
But I guess you probably wouldn't even wait that 3 days because caregiving is, like you said, is a 24/7, right?
Yes.
So the next day you'll be repeating it, which means likely every time you do it, you feel pain, then you know that is definitely not. Let's stop.
Yeah.
Review how you're doing it.
Yes, they should get help, or maybe they definitely should review what they have been doing, whether the technique is correct.
Okay. Then since we're talking about techniques and reviewing it, if you could give 3 golden rules of safe posture when caregiving, what
Okay.
would these 3 golden rules
Okay,
be?
first will be don't be gung ho.
Okay.
Because a lot of people tend to want to use their brute force.
Yes.
If they can't handle, they will just use all the strength that they have. So they will injure themselves. They will also injure the patient, right?
Yes.
Then secondly is don't take shortcuts.
Okay.
Yeah. I have witnessed quite a lot of helpers, Like even if you talk about my dad's helper, sometimes I do catch her taking shortcuts.
Okay.
If I want to, just for an example, when she transferred my dad from the couch to a wheelchair,
Mm-hmm.
I would have preferred her to get my dad to stand up
Yes.
onto a walking frame and then make his way slowly
To the wheelchair.
Yeah.
But they
And
tend
not-
to
yeah.
wheelchair straight to the side,
Or then she would just put his hands on her shoulders and then just
swing it over the,
swing. And then the other way would be swing and then just drop him on
the sofa, reverse. Yeah.
Yeah.
Okay.
Yeah.
I think those are really practical tips.
Yeah.
But you're right. So brute force, don't take shortcuts. And the third?
The third one will be don't rush. Take your time. Yeah.
okay.
Because when you are helping someone,
Mm.
there's basically no need to rush. Of course, you should plan ahead of time. Say, for example, if you're preparing a loved one for daycare, for example, you need to have ample time
Just correct.
to get them ready and not rush like at the last minute. Then you'll be,
Agreed.
you'll be moving things quite fast, and then you will tend to take shortcuts, and you will not remember the proper techniques.
And if you think about it, all those are in a way within our control.
Yeah,
Right? We plan ahead, we make sure we don't wake up late, we wake up on time, we give ourselves ample time to wash up, clean up, whatever, get everything ready. Then you can slowly, you have sufficient time to prepare to bring let's say, your elderly to the hospital, to the care services, right? You're right. So I think these three are very important points that our listeners should actually, tune into and remember it by heart, right? And now let's go a little bit deeper. So let's say we use, you see, when we talk about taking care of an elderly from a chiro point of view, or chiropractic point of view, there is a lot of lifting. But lifting does not necessarily mean just using your upper body to lift. It's not like you're going to the gym and doing deadlifts and all that stuff, right? There is a lot of legs and hip and core. So how can caregivers use their legs, hips, and core properly when lifting or supporting someone heavier? And especially whether it's the children or whether it's helpers, I mean, we don't know, they come in all shapes and sizes.
Yeah.
Right. So if someone is smaller than the other, what is the good way to use that hip, legs, and core to protect themselves and at the same time being able to carry out their duty, properly?
Yeah. I see that by the time someone becomes a caregiver, it's not something that they can prepare for. Because like myself, or I would say most caregivers will be kind of caught by surprise.
Correct.
And by the time they don't have time to be in a situation where train your core, maybe you're ready for caregiver, right?
Okay.
Yeah, caregiving duty. So we make do with what they have. So the best way to do it will be, first, I think you can try to coordinate with the loved one. Like say you're going to do a transfer, you want to get the loved one to coordinate the timing with you.
Right.
Like you're going to stand up, 1, 2, 3, let's go together.
Okay.
Or, like I said, don't be gang ho, right? Yeah, you can get someone, if you have some other family members around,
Together.
and if the loved one is a bit too heavy, lift
I see,
together.
I see.
Yeah, and of course, if you can, try to use more of a legs than the back. That will really save the back.
That's
Yeah, and save a
important.
lot of agony.
Yeah, as a person who has gone through a spine surgery, I fully understand. Yeah. So a lot of times it's like you said, I think a lot of times one thing I notice is that we don't like to ask for help.
Yeah,
Even when help
right.
is just next door or beside or in the room, for example,
Yeah.
right? Somehow I think, I don't know whether it's an Asian culture, it's like, okay, I'm doing it. And then you just don't, and then when something happens, that person will come running out and say, hey, why didn't you ask me to help?
Yeah.
Then you'll be like,
But it could be that the caregivers are exhausted as well. So they just want
That's
to
also
get everything
possible.
done as
right.
quick as possible.
all right. Now, okay, then let's go on to prevention. So what is a good, let's say a 5-minute daily routine, whether it's a stretch, whether it's a reset, what kind of advice can you give caregivers to, I would say, keep them injury-free, minimize the injury? So is that something they can do every day to sort of like warm up, warm down, and so that they're not stuck in a awkward position?
They can probably do some stretches. But
Okay.
of course, if they have a bit of time, they can do some daily exercises like building a core, like even
Planking.
as simple as planking
Okay,
might help.
okay.
Of course, the other break will be just step away from the caregiving, have someone to maybe take over the duty for a few minutes, even going out
Right.
for lunch on their own, or just going to walk in a park will be good.
So also a good, not just physical, but also mental break.
Yeah,
in a
mental,
sense.
yeah. And also, I think caregiving sometimes can be quite dull, and it might be good for them to also stimulate their brain, like maybe doing some Sudoku or some puzzles. Yeah, that might be also a good way to keep them fresh.
That's true, that's true,
Yeah.
that's true.
And of course, having a good support system is good. Get respite care and some maybe people who have gone through it before, or some friends they might know who are also doing caregiving. share some pointers to keep them a bit more sane and maybe even more inspired or give them some new ideas.
So a lot of sharings from others as well,
I think
right?
that's important.
Yeah, that's exactly what we're doing here.
Yeah,
so we can share with others. Then let's go to the home environment now. So caregiver is one. What about physical changes that we can do at home to reduce physical strain? So, of course, strength, your core muscles is one. What about bed, like the height of the bed, grab bars, and having ample space for them to maneuver wheelchairs, for example, or walking aids? So, what are some of the small changes that can be done at home instantly that sort of reduce this physical strain for the caregivers?
Yeah, I feel that for caregivers, usually we want to have a straight runway, like reduce having to maneuver corners.
Okay,
because that
that's a good
usually
point.
can be quite challenging for the older folks. And having assistive devices like transfer belts,
Right.
walking frames,
Okay.
and also handlebars along the wall, that will keep them safe.
Actually, it's interesting. I never thought about that point of having a clear, straight path to be that crucial. Right?
Because
It just didn't occur to me.
just imagine if someone has Parkinson, they have this very
Sort of
unsettling
erratic,
gaze, right? Yeah. So when corners comes, they feel very stressed, and
I see.
Yeah, they may not be able to control their balance as well.
Very
So,
simple.
Yeah.
I think those are very simple, but really good sharing in that sense. And what about, we come in all walks of size and lives and backgrounds, right? Some who are more well-to-do can afford to buy fancier stuff. Some may not be able to afford some of those fancy equipment. Are there any lower cost hacks that you could recommend, for example? So I mean, it's not always having to buy that electric wheelchair that is the fanciest on the road. But what about some other quick and easy hacks that is affordable, maybe even recyclable with our existing towels or whatever? Is there something along those lines that you could also introduce or recommend?
I don't think it's so easy because you want stability. You can't be improvising something on your own. Then
Okay.
you risk the patient using it and then they fall. That might even
That's true.
make
That's
it
true.
worse. But I think when finance is concerned, they can always approach AIC. I think they have some financial scheme can help people who are in need.
I see. That's
Yeah.
good. So the low-income families can actually approach AIC for support and
Yeah.
and funding, right?
Yeah.
Okay, that's good. That's good.
And of course, all these assistive devices are very important. But some people may not know about it. But when it comes in very handy to help with the transfer and to reduce also injuries to the patient.
I'm sure they plays a very crucial supportive role to in this whole caregiving journey.
Yeah. And of course, there are some other platforms, maybe even Carousel, where they can get maybe a use or a pre-loved ones.
Yep, that's a good one. That's a good suggestion.
Someone may have been done with this. They want to do an upgrade. They can get something a bit more affordable.
That's true.
Yes, but recently there have been some very interesting transfer devices, where if an older folk has difficulty getting out of the bed, or maybe if they are too heavy, there are some devices concoction where it's like a trolley.
Okay.
And you can move in and then get two pieces of metal to cup under their buttocks, and then there's a hydraulic pump where you can step on it.
So you lift it up.
You can lift it,
Then swing
then
out.
remove it, then move them out to the living room.
That's interesting.
Yeah, I saw those concoctions that are quite interesting.
Okay,
It will take a lot of stress off the caregiver.
the
and also
lifting,
the-
right?
yeah,
Actually,
yes.
yeah, that makes a lot of sense. Right. So caregiving isn't just about the body, right? It's also about the mind and the energy we carry every day. So let's go to the caregiver's well-being. Let's look at the emotional grounding. How, on a holistic level, how can we help them gain have that holistic wellness, right? Caregivers, I don't know whether you are guilty of that yourself. Caregivers often neglect themselves.
Yeah.
Okay. How can they prioritize their own well-being without feeling guilty?
I feel that they have to understand that taking care of themselves is not selfish. It's essential. It's very important because they have to be well in order to be able to take care of their loved ones better. Yeah. So a lot of people say that, I have no time for this, I have no time for that, I have no time to see a doctor. But what happens when they get sick? Who's going to take care of their old folks, right?
It's an interesting perspective. Let's say, I can almost imagine, could this stress also be coming from the elderly or the patient that they're caring for? Because that person now is maybe sometimes demanding 24/7 support, but they don't think about the caregiver's point of view, right? How do we find an alignment, or in a way to sort of get an equilibrium that both are happy with the level of service and the level that they're receiving in that sense?
I think that will be a very difficult thing to do. It depends on the patient themselves also.
Okay.
But I feel that a lot of caregivers, they may not be also they may not have the mental capacity to think beyond what they're obliged to do. So if they have to take care of their old folks for 24/7, and then to have them to think of themselves and taking time off to maybe see a doctor or maybe even see a chiropractor, it might be something quite difficult for them. And of course, like I mentioned earlier, when you have that on switch already for caregiving, right, the mental switch,
It's always
it's
on.
very hard to turn it off or even pause.
So it's important that we remind ourselves that, self-love is, you don't have to be guilty about self-loving,
Yeah, I shouldn't.
right? And I think like you mentioned, in order to go the longer mile, you must have sufficient rest as well in order to be able to carry out those duties consistently, right?
That's right.
So I think those are very good points and good sharings. What about things like sleep, hydration, and simple movement play into preventing burnout from a chiropractic's point of view? So I think sleep is important, hydration is important, and that little movement. So how does that help prevent burnout?
Yeah, because sleep is the only way your body learns to recharge. So when you sleep, your body repairs itself.
Right.
And already for caregiving, it's already so mentally so stressful and physically
Okay.
so stressful as well. So when you get to have of course, that will be a luxury. You may not be able to get undisturbed sleep, but try to get as much as you
Okay.
can. Maybe even an afternoon nap may be helpful to help the body recharge or do its own repair. Then hydration is very important because most people tend, even if someone is not doing caregiving, they tend to neglect the hydration part. So that can affect your spinal health. It can also affect a person's energy level as well.
So actually water has a lot of complications if you don't have sufficient in the day.
Yes, definitely.
All right.
Of course, caffeine will be a substitute for a lot of people. Yeah. that
Honestly,
is-
not a great, I would say, alternative in a
no,
way.
it's not. It's not.
It's a good booster for the moment, but
Yeah.
not a long-term
Yeah,
solution.
because of all the caffeine.
Yeah,
It
exactly.
keeps you awake. Maybe keeps you alert for a while. Once it's used up,
Yeah,
then you are crashing again.
exactly. So water, I think, is still one of the best. You mentioned already, once you're on, you're 24/7, always on, right? What's a micro break that you can recommend to caregivers who barely have time to rest? So they're always on, but they still need to take their pockets. So a 5-minute break, a 10-minute, a 15-minute coffee break, whatever. So what are the micro breaks that you would think would be great for caregivers?
Probably just step out if they can. But it also depends whether they're able to get some help. Because
Okay.
if they can't, then perhaps having someone to come and visit just to take some stress and speak
So
to
you
them.
Okay,
Yeah.
okay.
Yeah. Otherwise, some mental breaks would be things like maybe doing some puzzles.
Those you can do anytime, anywhere.
Yeah, anytime, anyway. Or
Or
maybe,
go through Facebook.
yeah. But I think
scroll
these
a little.
days, what people will be doing will be just looking at their phone or the Facebook or the
Just to detach
social
from
media,
what's
right?
happening.
Yeah. But that's just a different problem. There will be a lot of looking down. That will create neck pain.
So there's a very different chiropractic
Yeah.
problem already. After
Yeah,
that.
true. But if it gives them some relief, like a micro break in their mind, spiritually or emotionally, that will help. That goes a long way
Yeah,
to
that's
keep them healthy emotionally.
That's good. So breaks are important, but not too long because
Yeah.
you need to be watching
Exactly.
you need to be caring as well, right?
Yes.
So let's go back. Let's move on to reflections of this whole journey. So if there's one habit caregivers should start today to prevent long-term damage, what would that be? Just start with one.
Okay. They have some awareness of caregiving because it's something that everybody has to go through, like it or not. Because as you get older, remember that your folks also will get older.
Yes.
And they'll need you.
Yes.
So it's not too early for anyone to learn about caregiving. Of course, if you think about the muscular structure, start working on your core.
Okay. That's something I realized I didn't activate my core when I was walking last time, and that So
But
that's
I think good to have some awareness of what it takes to be a caregiver. Like even things like helping someone to get out from a chair. Just have it's not. I don't mean to practice, but have that awareness. Look around when you see someone helping someone else. Yeah, just have that.
I love that.
Yeah.
Because I think today, all caregivers would appreciate any form of help, right? And I've always said caregivers understand another caregiver, and that's exactly why you're doing what you're doing. And I hope all the caregivers out there will also extend that kind of help to other people and make this whole place a much more gracious society. It's an aging It's an aging population everywhere, not just in Singapore. The number of caregivers are getting lesser and lesser. The ratio is not great. And if we can only be more empathetic and more supportive of each other, I think the whole world will be a much better place to live in. Yes. And lastly, this is going to be for all the caregivers. What's a message that you can give to these caregivers who are exhausted, both physically and emotionally right now?
I mean, caregiving is an endless journey, and it's a thankless journey as well. So I feel that they should always check whether their cup is empty, whether the tank is empty.
Okay.
And if they are, they should get some help, fill up the tank, take a break, recharge themselves so they can do a better job. Take care of their loved ones.
Right. So important is don't forget to take care of yourself. Because if you don't take care of yourself, you can't take care of others.
Exactly.
So that's a good point. Well, Kelvin, thank you for being so open today, not just as a chiropractor, but also as a fellow caregiver. Your honesty, your practical tips, and your heart. I think many listeners will walk away feeling a little lighter, a little wiser, and a lot less alone. And for those tuning in, if you're a caregiver dealing with aches, pains, or you simply want more safety, Kelvin's clinic is a great place to start. He runs Family Health Chiropractic Clinic, where his focus is helping people move better, heal better, and live with less pain. You can find him on LinkedIn or book a visit directly through his practice at familyhealthchiro.sg. To every caregiver listening, thank you for what you do. Caregiving is love in action, but love also needs support. Take care of your body, your mind, and yourself. You matter too. Thanks for joining us on Voices of Care. I'm Ivan, and I'll see you in the next episode. Bye.